Hey everyone, welcome back to Keeping Up with the Chaldeans. I'm your host, Junior Bindu, along with my co-host, Anthony Toma, along with our friend Kevin Semma coming in today from Maple Eye Care. Kevin's here to let us know how important it is for our vision to be checked up on and corrected. Also, we're here to support him with his new facility that he just opened up, and his office is located on Maple and Lasser. So we're here to welcome him with his new business, along with the occupation that is entering in our community and much, much needed. So good to have you on, brother. How are you?
Thank you.
Good, good. So if you want to let the audience know, who you are and a bit about yourself and, some of your background and your skill set. So that way they get to know who Kevin Semma really is.
Yeah, for sure. Kevin Semma, so I'm owner and optometrist of Maple Eye Care and Eyewear in Bloomfield. So we just opened up a couple weeks ago. It's kind of been a passion of mine to get this practice open. I graduated optometry school about 5 years ago, and so I've been practicing and finally jumped ship to kind of do my own thing. So built a brand new, beautiful facility to offer kind of state-of-the-art eye care. So we're talking comprehensive eye exams, emergency eye visits, things that just, we take for granted our vision all day long. So we kind of check all those things with really cool equipment, kind of state-of-the-art technology. And then after we set you up with the eye exam, get you into our optical, we've got a wonderful selection of glasses, sunglasses, contact lenses, so tons of options to kind of meet all your visual needs, demands.
Sure, and obviously you just didn't with a snap of a finger open up a facility just like that. You had a little road to success to get to this point. So if you want to let some of the viewers know, where you worked, or even your accolades, like the schools and stuff that you went to get to this point, and the hard work it took to get to here. So.
For sure. So I went to Wayne State, graduated from Wayne State, and then I went down to Florida, Nova Southeastern, for optometry school. I was there until 2017, and then I came back home to practice. So I was practicing in Farmington for the past 5 years, and that's kind of helped set me up to kind of open up the practice here. One of the misconceptions a lot of times is, okay, optometrist, ophthalmologist, which one do I have to see, right?
Yeah.
So for optometrists, we go through 4 years of undergrad training, and then we go through 4 years of graduate school.
Okay.
And then after graduate school, we have an option to do a residency in a wide variety of things like ocular disease, contact lenses, pediatrics, things like that. Yeah. So think of us as kind of like parallel to dentists. So
Okay.
actually, at Nova Southeastern, one of the reasons I picked that school is because we actually did a lot of intertwining with the dentists. So I took anatomy lab with them. I took pharmacology with them. So we're trained very similar levels in terms of kind of the basics of being a healthcare professional.
Yep.
And then once you graduate, 8 years later, boom, you're an optometrist. Yep. So you think of me as kind of your primary care doctor of your eyes, right? So
Sure.
I'm there to figure out issues, diagnose, treat, kind of figure out your vision issues, and then if something's wrong that requires a surgery or something that's out of my scope of practice, then you see an ophthalmologist.
Sure.
So ophthalmologists is a little bit different. So they go to undergrad first, then they go to medical school for 4 years, and then they match into an ophthalmology residency, and that's usually about 3 years. Wow. So they're a little bit more trained in the eye diseases itself. They do more surgery. So they'll do LASIK, they'll do cataracts, they do injections in the eye, all of the really intense stuff, eye diseases. So I work hand in hand with the ophthalmologist all day long.
Gotcha.
So you've got your dentist who doesn't pull your wisdom teeth, right? So you send it to an oral surgeon. And kind of the same thing. I can't do your cataracts, I can't do your LASIK, but I'll assess you. I'll tell you if you're a candidate. I'll do your pre-ops. I'll send you to the surgeon, and then depending what surgeon I'm working with, I'll even see you back for your post-ops. So I'm trained to handle all the pre and post-op complications for a lot of kind of general surgeries as well.
Got you. Whew, all this for this young man, and he's just hitting his 30s, right? Jeez. So that's a lot you accomplished. For people to know that's putting in 8+ years. That's a lot of dedication to get into it. And then you said you apprenticed for how many years were you apprenticing before you finally did this?
So I was just working as a regular optometrist for about 5 years. I was at a private practice in Farmington and just doing my everyday. And I got my feet wet, kind of saw patients, got comfortable seeing patients, and then behind the scenes kind of learned the business. And after about 4 years, the wheels in my head started turning. I was like, all right, I can't really work for somebody my whole life. I've got to do something. So that's where, optometry has like this perfect marriage of entrepreneurship and being a healthcare professional. Because you can be, I love being a doctor. It's awesome. I mean, I
Sure.
save vision all the time. I've saved a few lives. There's so many things that you can catch with the eye. But then being an optometrist, you get to marriage it with an optical shop. So you get to sell the glasses, you get to sell the contact lenses, and so you've got kind of your goods and then you've got your services, and so you kind of have to figure out, okay, how do I run a business, and then how do I see patients?
Sure.
So it's intertwined, but I enjoy it because I kind of get a little bit of that entrepreneurship thing that we have inside of us as Chaldeans. You always want to do your own thing, have your own business, but then I also get to do my I'm a doctor too, and I get to examine the eyes and things like that.
What are some of the services, and then people just walk right in?
Yep. So you've got a couple options. One, like you can make an eye exam. We'll check your prescription, see if you need glasses, see if you need contact lenses, and then based off our eye exam, I make recommendations. Hey, this is what you need to protect your eyes from the sun. This is how it can lead to we talk about your computer demands, how your eyes are really tired, and then I take you out to the optical, and then look at glasses. Then there's so many different lenses that you can choose. We can do computer fatigue lenses or anti-fatigue lenses. We can do reading glasses. We can do nighttime driving glasses. We can do prescription sunglasses. So it's kind of my job to kind of educate you on what is going to be the best solution for you to meet all the visual demands that you have. Your visual demand here is different than your visual demand at home versus you sitting at the desk for 12 hours a day.
To talk about some of the symptoms that people are probably feeling and going through that don't understand that it's eye related. So listen, COVID, we've all been working from home, right? Everybody's staring at the computer, we're staring at our phones 10, 12 hours a day. We do everything from here now. So you actually forget to blink a lot of times when you're doing your tasks, when you're staring at the computer, because you're just so engrossed in that activity. So when you forget to blink, your tear layer breaks up a little bit, and then your eyes become dry. So if you feel like your eyes are constantly watering, that's actually a sign of dry eye, because your corneal reflex is saying, hey, I'm not producing enough tears, keep sending tears, and people are like, why are my eyes so watery? And they're actually dry. So you can have kind of computer-related dry eye symptoms. Your eyes are always red, they're itching, they're burning. So all those are just like, symptoms associated with just near complaints of just not, And then there's external factors too, right? You're sitting in your car, you've got the heat blasting at your eyes, it's winter time, you got the heat blasting everywhere, so now your eyes are drying out from the air around you.
Sure.
So it's kind of my job to kind of figure out, okay, is it environmental related, is it occupational related, and then we do all the diagnostic testing to kind of vary between the two and then come up with a custom treatment plan. Is it over-the-counter eye drops? Is it prescription eye drops? Is it vitamins? So there's so many different ways to kind of treat a simple disease like dry eye that actually affects a lot of people.
Do we as Chaldeans have, large segments of races have certain diseases or degenerative diseases that happen to them? Do we as Chaldeans have a unanimous eye-related issue? Do we ever run into cataracts, or are we prone to something else that do you see that, or do we know of anything like that?
So it really depends on genetics, and I kind of get what you're saying. So cataracts, that's an age-related disease.
Okay.
So everyone, you hit your 60s, you're going to get a cataract, no matter who you are. So that will happen with age. With Chaldeans, there's really no discrimination. I've seen Chaldeans with glaucoma. I've seen Chaldeans with macular degeneration.
Gotcha.
I've seen them with retinal holes, retinal tears.
Sure.
There's not one specific diagnosis that's really caught out at me. But for example, there was one family I've seen, and everybody had narrow angle glaucoma. So basically, the drain in their eye was very narrow, and their pressures were going really high, and they were starting to lose their peripheral vision. And a lot of them didn't really know they had it because it's asymptomatic. And so I saw one brother, and I said, hey, let me see your sister. I saw the sister, and then I saw the other sister, and they all kind of had, and then, I'm like, okay, you guys all need to get checked. You guys all have to have this procedure done to kind of correct this so it doesn't become a long-term issue where you can lose your vision. So it can run in families with certain diseases for sure.
Yeah, we have it in ours. We had retina pigmentosa, so that was something that ran to hereditary. But like you said, it's this scare to almost say, holy cow, my vision's starting to trip out right now, and then to come see you is sometimes a little bit of a extra step somebody doesn't want to take. But I mean, I'm sure you'll make them feel comfortable enough when they get them in and get them fixed up right with that.
For sure. So there's this misconception that I'm 20/20, I see great, I can drive no problem, I have no issues, right? Well, a lot of times that's the case, right? But lurking in the background, you can have diseases that you don't even know you have. You can have high pressure of the eye, you can have retinal tears, retinal holes, and all these things can lead to blindness, and you don't even know it. So, a couple of years ago, I met a gentleman. So this is kind of a classic scenario, 45 years old. Everybody in their 40s starts losing their ability to focus up close, and we'll get back to that in a second.
But he's like, I'm here for my first eye exam in my life. I'm 45. I said, all right. I check his pressures. Pressures were over 30. This guy's lost about 60% of the tissue in his optic nerve. So he's going to lose his peripheral vision, and we had to save what's left of the central vision. So most likely he'll lose a ton of vision. If he would have been seen in his 20s or his teens, and we caught that a little bit earlier, we could have saved a lot more of his vision. So, and he had no idea. It's just lurking in the background, and your brain kind of does a good job of hiding it from you, unless it's really symptomatic.
So I'll tell you something wild that most guys, like in our community, because we see it so often, that they don't get in their head that they should pay attention with their eyes, but a lot of them are inside the grow rooms these days, and that light is just blaring in their eye, and they're not using any protective eyewear in there, and it's all UV and everything that's coming in. And now, besides our community, I mean, with our customers that I see, they're getting little floaters that are now coming through their eyes, little black spots that are coming, look like a fly's always flying.
Yeah. What can they do about that?
So floaters, it's normal to have little floaters. Basically, consider your eyes like an inflated structure, right? And it's inflated like a beach ball, and it's filled with jelly called the vitreous. And so this jelly, it moves around, it moves and grooves, and as you get older, it becomes more liquidy. And so as it becomes liquidy, light comes through your pupil, it hits that jelly, and it casts a shadow on your retina. So if you look at a white wall or a blue sky, sometimes you can chase something like, okay, no big deal. And that's very common to have. Sometimes floaters can be a cause of concern. So, you're probably used to seeing the same 3 or 4 floaters, right? Now, if something changes suddenly, like, holy crap, I've got 20 new floaters I've never seen before, or you're seeing flashes of light. So this is like a lightning bolt going off or spark going off, or peripheral vision loss, almost like a curtain over your vision. Now that's in a medical eye emergency. So that you call me ASAP, because that could be signs of a retinal hole or a retinal tear or even a retinal detachment. So if you have a retinal detachment, I mean, it's time of the essence. You need surgery within 24 hours. You've got to fix that issue. So floaters are not a big deal. But you should, if you've had a bunch of them and you've seen them for a while, come get checked out. We do a dilated exam. We take pictures of the back of your eye, and we make sure those floaters are no big deal. And if they become a big deal, then we cross that bridge when we get there. But that's important to evaluate to make sure nothing's kind of lurking in the background, because they can start small and all of a sudden go big, and you just don't realize it.
So my daughter has blurred vision in one eye. She's 10 now, but we realized it when she was like 4 or 5, and she's been going to the doctor out in Ann Arbor. She had a thick lens, a corrective lens, and then she was supposed to be wearing an eye patch to help it. She didn't really wear the eye patch. The lens really didn't help, and so they're talking about surgery as the last resort. So
how did you as a parent come across that at 4 or 5 years old? Like, how do you
they test them in school. They do eye tests in school.
And they see one to the other, then they just take them.
They catch it.
Yeah. Yep.
Right now, like it's to you saying that, I walked into Costco and I just same thing. I was like, man, it's about that time. 2 years ago when I started working with him, I never in my life used reading glasses. He'd have these glasses on, and they'd do this and he'd put them on. And I was like, man, am I going to get to that soon? Myself, I'm just saying, like in my head, sure enough, in less than 6 months, I realized that I walked into CVS and bought a pair of those reading glasses, because this started getting really rough and bad. But now I know, so I am going to come see you, because I'm going to need that. What's the steps? I'm calling your office, or how do I make an appointment, or how does this all work when we want to get in with you right now?
Yeah, for sure.
I want to do an eye exam.
Yeah, I got you. So let's touch on, based on you not be able to read them close.
Yep.
So everybody in their 40s, majority of people.
I'm 20, by the way.
It's 29, right?
Yeah, yes.
Exactly. So they lose their ability to focus up close. It's aging. It's the muscle in the eye not being able to move the lens in the eye like it once did. So you'll start to notice it 42, 43. Oh shit, I gotta hold things a little bit farther. You're making your font bigger on your phone. Your eyes are getting tired. And usually around 45, 46, 47 is really bugs you. So that's called presbyopia, and we have tons of options to kind of correct that. So your first option, reading glasses. You can get over-the-counter reading glasses, and that works for some people. We can make custom reading glasses. We can make progressives, which have your distance and your reading in the same lens. And then we do contact lenses to correct it too. So if you don't want to carry that reading glasses around with you, we'll put you in contact lenses so you don't have to mess with glasses anymore.
Gotcha.
So those are a couple ways to kind of fix that issue. In terms of making an appointment, it's really simple.
Let me stop you, because this is kind of important for people out there.
Yeah.
The contact lenses are just for reading. Well, for all purpose,
right,
but they'll correct the reading issue.
Correct. So a couple different ways we do contacts. First is distance vision. That's kind of what most people wear. They put contact in both eyes, and it corrects for far away.
Yep.
Then an old school method to kind of correct for reading is called monovision. So you probably hear people saying, okay, I wear one contact in one eye, or they're kind of, I got a reading eye and a distance eye. So it's an old school way of kind of making your dominant eye see great far away and your non-dominant eye see great up close. And then the newest generation of contacts are called multifocal contacts. So what these work off pupil size, and both eyes are corrected for distance, and both eyes are corrected for reading. So you don't get that weirdness of monovision, but you get distance vision and you get up close vision in contact lenses, and then you get to shy away from the reading glasses.
So I heard you say dominant eyes, so that's not going to affect your shooting.
Yeah, so actually it's one of my questions I ask people to figure out the dominant eye. So I have a test I can do, but I say, hey, are you a shooter? Which eye do you look out of your scope on? Or do you use a Polaroid camera? Which eye would you use on a viewfinder? And that's how you can figure out. 'Cause a lot of times people are cross dominant. They can be right eye or left eye dominant and right hand.
Oh, really? That's wild.
Yeah.
So if I when I come to you, you can make recommendations based off of that test to see if it's something that I need for whether it's going to be reading or the distance seems to be fine, but again, you may be able to see something through your test that I don't realize on a day-to-day.
So finish your thought that I interrupted.
It's all good.
Yeah.
So to make an appointment, it's really easy. You can either call our office, 248-246-4466, or if you jump on our website, mapleeyecaremi.com, there's a Book Now button. It's really seamless. You just all my availability is on there. You upload your insurance information, upload your complaints. Everything gets sent to me in a PDF. It's all HIPAA compliant, which is really awesome. And then you're on the books. So I made it really easy. You can just do it from your phone.
So as a typical Chaldean, I asked you a typical Chaldean question, right? And I said to you, so like your designer fashion, where are you going to have this? I asked the glasses of the Gucci's and all that other stuff. But you took a different route. And I want to talk about that route that you took on the lenses and stuff that you're going to be providing. So I know we're going to have a shot of it open, but again, like I know these here, the brands that you're going to be working with, you were mentioning is going to be different, and because of why.
Tell us about it.
Yeah. So to kind of backtrack a little bit.
I put these on too.
Yeah, of course, totally. So, before I got into optometry school, I was actually an optician. So that's the person who kind of helps you select the glasses, and I worked in the lab too. So I would make the glasses myself. I'd cut down the lenses. So I kind of fell in love with eyewear at that time because it's almost like a piece of art, the lens you recommend, the frame you recommend, it comes out as like this beautiful piece. You give it to a patient, and it's like jewelry for the face. So that's where I kind of really fell in love with high quality lenses, high quality glasses. So when I kind of started to brainstorm, okay, what brands do I want to carry in my office? This was a huge contested debate because, Chaldeans love our brand names, right? We want our Gucci's, we want our Pradas, we want our Chanel's.
I was just trying to see. I was trying to see. I was just trying.
Those designers are great, but there's kind of a whole background story to a lot of those designers. So a lot of the eye care industry is a kind of a big monopoly. So there's a couple big monopolies that actually just pay the licensing fee to use that name Chanel, use that name Gucci, and then they basically mass produce them on the same assembly lines. So it kind of cheapens it out, and that craftsmanship you expect from that brand is a lot different than getting a Chanel purse, versus a pair of Chanel sunglasses, if that makes any sense. One's mass produced for the masses, and one's a very unique item to carry in a boutique store. So I went more of kind of an independent frame line route. So I'm supporting companies that you probably have never heard of, but are very unique. So right now you're wearing a brand called Masanaga.
Okay.
So I'm actually the only vendor in Michigan to even have Masanaga in our optical. So that company started in 1905. And it's one of the first companies in Japan that started making glasses. So those are handmade in a factory. And the cool thing is the factory is the designer, and that's very rare. Usually you have the designer and then like 6 designers will use the same factory. So this designer is their own factory, and they make a lot of other designers, which is pretty cool. So they have their hands involved in everything.
Sure.
And then just the craftsmanship that goes into those.
Yeah.
It's Japanese acetate, so everything's hypoallergenic. You're not going to get a rash on your nose. The way that they're balanced, the weight is really comfortable.
I'm going to tell you, they're very, very light. You know what I'm saying? Usually I'll get that little bother right here on the tip of my nose. These are very light.
What are those something like that cost? Since you hyped them up pretty
good.
I don't know if we can afford them now.
Yeah, so retail on a pair of those is roughly around $450.
Nice.
So for that brand right there.
Beautiful.
Yep. So this is actually Masanaga as well. So these are, if you feel how light these are titanium. So it's pure titanium. It's not an alloy where it's mixed with any other precious metals, and I mean, they're
Zoo
really
Club Days
lightweight.
AT, baby. That's what it is.
Yes, sir.
Yeah, so I like to tell people, you go to the second floor of Saks and Neiman's, right? You look around, you see all these brands that are really high end. You never really heard of them, but you're
Sure.
like, wow, that's a nice T-shirt for $90, right? But then kind of the same thing with glasses. Like these are really well-made glasses. So Masanaga is one of my flagship lines, and I'm the only one in Michigan to have it, which is pretty awesome.
Why is that? Is it an exclusive deal
It's-
you made? Or?
No, it's an exclusive line. So a lot of people in the area just want to carry what the masses have, right? They want to have the Gucci's and the Pradas and the Tiffany's, and that wasn't my style. I don't want to compete with Facebook Marketplace. I don't want to compete with eBay. All those brands are kind of saturated all over the place. So I want to offer unique, independent things that you're not going to find at Nordstrom's Rack, that you're not going to find,
With quality.
Exactly.
I'm
Yep.
having on right now. I'm telling you, the feeling is just you.
Yeah.
I could actually, if I had to rock them, I would put them on for a few hours.
For
a week.
sure.
What are those lenses that he's got in there?
So those are just dummy lenses right now.
Okay.
So they're just plastic. So we pop those out when we make the. We actually have a lab in our office.
Well, what are the lenses? I'm not talking about Junior.
That's a good punchline.
So go ahead. I'm sorry.
That's what these are. These are the.
Yeah, those are Masanaga. Yep. So these are pretty cool. These are goatee. So goatee is made in Switzerland. So if you kind of read in the inside of this,
Good luck.
Yeah, you got your.
I need my readers for this one.
These are sweet. See, I like I said, just the quality of them being so light.
Can you get it?
Nope. Switzerland, it says. I see Switzerland.
Yeah. Do you see the word next to that?
No, but what he does see that he's gonna.
Left or right?
He sees that he's gonna
Right
have to
here.
see you soon.
No, I can't read that.
All right.
It
So.
says Walmart.
No,
This is
Walmart.
walnut,
Yeah,
right?
So this says hand polished by Walfred. So you
Oh,
actually
okay,
get the
so-
person who actually hand polishes. He's in the factory, embosses
Oh,
their
shit.
name inside the
That's
frame,
cool.
which is pretty cool. The other line that's pretty cool is SALT, and this is a really, really cool line. So SALT stands for Sea, Air, Land, Timeless. And so the whole thing about this company is they're started by a bunch of surfers in San Diego. So they're kind of like Newport
Cool.
Beach. So you can actually, their whole motto is we surf in the morning and then we go to the office in the
Let me
afternoon.
see those. These are the kind of glasses that I always buy when I buy glasses.
Yeah, so they're all about
Oh,
just
wow.
taking things off
Oh, yeah,
landscape,
there he is.
earth, like their colors,
Wow, these
Yeah.
are nice.
Yeah.
for sure. So you see
They're
how that
light.
has a matte finish on that?
Yeah.
So what they do is to get that nice polish, they put them in a tumbler with bamboo rocks and sticks for 4 days to get all the
Oh, okay,
imperfections
okay.
out of the
Yep.
frame. So you're paying for a lot of hand craftsmanship, a lot
Yeah.
of quality that went into these frames.
That lasts.
And they're going to last you, exactly. They're going to last you 1 year, 2 years, and they have warranties on them as well, which is great. So,
These are
something
great,
happens,
man.
manufacturer defect, I'm going to replace it for you. You scratch your lenses, I'm going to replace them for you.
We're gonna ask
Those
the
are
viewers,
awesome.
who are these better, AT or JB? Probably AT because he had that Donnie Brasco look. Beautiful though. This is great.
Thank you,
What I
thank
want
you.
to touch on is what you said. Craftsmanship has been lost for a long time
Oh, yeah.
because of mass production. So when it's stuff like this, it's important because you want them to last. This is an investment.
Exactly.
It's not just a pair of sunglasses that you just bought and want to wear.
For sure. And you invest a lot of money in the lenses. I mean, the frame itself has a cost, but the lenses themselves have an expensive cost as well. So, you want to make sure that you're putting them in a frame that's going to last. You don't want to spend all this money and then the frame breaks in 6 months and then you're going to get a whole new pair of lenses, whole new pair of frames. And so you pay for quality that's going to last you, 2-3 years for sure.
What else do you want to cover before we close this out?
It's just kind of what we offer. So, we're primary care, so we do eye exams, glasses, contacts. I do a lot of medical necessary contacts too, so patients that have corneal issues like keratoconus. We have eye emergencies, so if you have an eye emergency, you call our voicemail. There's an on-call line. It goes to my cell phone, 24/7. So if there's any issues, I'll meet you at the office. I live not too far from the office. But yeah, I just, I'm really excited to be part of the Bloomfield Hills community. And
So you call it an office, but it's kind of a retail setting?
it's a full, we've got a full optical, and then we've got 2 exam lanes, a
Okay.
pre-testing, a lab, so it's a full private practice.
What are the hours there?
So Monday, we're there from 9 to 6, Tuesday, 9:30 to 5, Wednesdays are late days, so 10 to 7, Thursdays, 9:30 to 5, and then Fridays we're closed, and Saturdays I'm there 8 to 2.
Is that typical for eye care to be closed on a Friday?
This is just me kind of wrapping up the hours as I kind of build the practice.
Oh, cool.
So the goal would be, if I build up the practice a little bit more, I can be there 6 days a week and have another doctor there. So
Yeah, so let's support him and
Get him to
get
7
out
days
there
a
and
week if
get
we
him
can.
7 days a week.
Yeah, it's different now. We're not doing Sundays off. No. It's different for us. Well, it's
Gotcha.
good. Is all your information on your website?
Yeah.
Everything can be found
everything's
on
on
there.
my website. We've got
Any-
Inst-
social
In the
media?
description too.
Yeah.
We'll have everything in the
yeah,
description.
Maple Eye Care MIs, my Instagram, it's our Facebook page as well. So everything can be found on there. The link to book is on there, and yeah, you can check out all our frame lines on our website as well.
Awesome.
Kick-ass.
Well,
Kick-ass.
before we close out, we always ask our guests one simple question. Some don't have the answer, most do, but some don't. What does it mean to you to be Chaldean?
Oh man, that's a good question.
That's why we
to
put
be
everyone-
Chaldean,
put you on the
that's
spot.
family.
Yeah.
Family. I lived in Florida for 4 years, and people are like, "Oh my God, you lived in Florida? Why'd you move back?" I was homesick.
Yeah.
I'm one of 6 kids. I miss my friends. I miss my cousins. That's what it means to be Chaldean. It's family for sure.
Do you want to shout anybody out real quick before we go?
Yeah, I'll shout out to all my siblings and my parents and everybody that's been supporting me along the way.
Awesome.
Good. Well, best of wishes to our friend Kevin Semma here with Maple Eye Care. Make sure you support him. It's our new era right now, and we've got a new generation that's doing a lot more things than what we used to do. So let's give this guy all the support that he deserves. I'll definitely be seeing you myself.
Please do.
All the information that you've got to watch and see on this interview will be at the bottom of the captions here below. Make sure you guys hit like and subscribe to our YouTube channel. You'll see us anywhere from Spotify, iTunes, and any other platform, YouTube, and many others to be able to listen to our podcast. And from myself, Anthony, Kevin Semma, Maple Eye Care, we are signing off with Keeping Up with Chaldeans.
Thank you, everybody.
Cool.